Hello, my name's Jacalyn. I'm going to be doing an exam on your head, ears, nose, throat, mouth, and neck, okay? All right. We're going to start with just your skin. I'm just going to look at your skin of your face, your neck here. I'm just looking at the color, any lesions, the symmetry, anything like that. I'm just going to test for some elasticity and good turgor. So good there. Very good. All right, good moisture, no ores, anything like that. So I'm just gonna go ahead and look at your hair now. Just looking at the color, there's no gaps of hair loss, anything like that. I'm just gonna palpate your scalp here, just making sure there's no bumps. Okay. Now I'm just going to look at your nails here. I'm just going to look at your nail beds, your cuticles, just looking at the color, capillary refill here. All right, good. Now I'm just going to measure your nail beds. So I'm going to have you put your nails up together like that. Just want to assess that. All right, very good. All right, now I'm just going to look at your head and your scalp. Look at how you're holding it. No tremors, anything like that. The shape, no trauma. Good. I'm just going to look at your face. I'm going to look at the symmetry like that from one side to the other. Then I'm just going to palpate a little bit here too. No lesions. Okay. All right. Now I'm just going to palpate your neck here and see symmetrical. I don't feel any bumps or anything like that. No nodules. Good. All right. I'm just going to feel your trachea here. Okay. Good. Feels good there. All right. I'm just going to have you swallow. Good. Your hyoid bone moved up and down, which is good, what we want to see. Now I'm just going to check range of motion with your head. Go ahead and lift it back and forward and side to side if you can. And then all the way around. All right. It's a good range of motion there. And now I'm just going to feel your lymph nodes here. So I'm going to go through them with you. So this is your preauricular here. Just making sure they are not pea-sized or bigger and not hard, anything like that. Post-auricular here. You have occipital back here. We got tonsillar here. All right, submandibular. Okay, and submental. Good. We have an anterior cervical lymph nodes. And then posterior cervical. Okay. And then some above your collarbones, supraclavicular, and then below infraclavicular here. All right. Now I'm just going to assess the spinal processes of your neck back here. I'm just making sure they are not bulging, anything like that. Any pain at all? Okay, good. All right. Now I'm just going to feel the mastoid process on the back here. All right. Good. I'm going to go and just assess your thyroid now. We did the trachea. I just want to look at the thyroid now. All right. Now I'm going to come behind you. I'm going to have you swallow. This is just going to test your thyroid moves up and down appropriately. I'll let you know when to swallow. All right, go ahead and swallow. Okay, perfect. So it moved up and down appropriately like it was supposed to. All right, I'm just going to listen to a couple things here, just checking for bruise. Okay. Okay, very good. Nothing there. All right. Now I'm just going to feel your temporal artery here. Very I'm going to check your TMJ here. So this is just your joint here. I'm going to have you open your jaw. Okay, close. Go ahead and open again. Close. Good. No cracking, anything like that. All right, now I'm just going to feel your ears. I'm just going to feel the pin of your ears. Make sure they're symmetrical, your earlobes here. All right, I'm just going to go ahead and get my scope out. I'm going to take a look inside your ears here. I'm going to look at your ear canal, your tympanic membrane. Make sure everything looks okay there. All right, so I'm just going to pull. I'm just going to pull up and back on your ear just to straighten out that canal. I'm just looking for a nice pearly gray tympanic membrane. Very good. A little bit of earwax in there, which is normal. This side. And good, nice pearly gray membrane there. Perfect. Okay. Now I'm just going to go ahead and I'm going to look at your eyes here. All right, let's go ahead and just look straight forward. Good. Nice, round and reactive. And they're both reacting at the same time here, constricting and dilating. Say about a size 4. Okay, so I'm going to have you look at my pen light. And then I'm going to have you look at the wall behind me. This is also going to test that. Go ahead, look at the pen light and then the wall behind me. Good, constrict and dilating, very good. All right, and then I'm just going to go ahead and look at your nose here, okay? So I'm just going to pull up, I'm just going to look inside, make sure the mucosa looks good. No lesions, anything like that in your nose. Okay. Now I'm going to do something called a whisper test. I'm going to plug your ear here and let me know if you hear the word I say, okay? Apple. Okay. And then this side. Train. Very good. All right, and then I'm going to have you go ahead and stick out your tongue. Just go ahead and stick out your tongue. I'm just testing that cranial nerve. I'm going to assess your tongue here, looking at that mucosa in your mouth. Go ahead and put it back in. Open up. Very good. Nice pink. No sores, no lesions, anything like that. Looking at your teeth. Good dentation here. Go ahead and open. I'm going to look at your uvula. And you have no tonsils. Okay, very good, very good. All right, and then I'm gonna test the patency of your nose. So I'm gonna have you close one side and breathe in and out. Good, and then do the same for the other. All right, very good. Okay, so I already looked at your nose. I'm just gonna feel it a little bit here. Very good. All right, and then I'm gonna feel your sinuses here, your frontal. And then your maxillary here. Very good. No pressure or anything like that you feel? No. Okay. All right. Now I'm just going to look at your, go ahead and close your eyelids. Make sure those are symmetrical with the skin there. Eyebrows are good, symmetrical. Go ahead and move your eyebrows up, down. Very good. Okay. Now I'm just going to go ahead and look at your eyes now. All right. I'm going to come to this eye first. I'm just going to move you a little bit. All right, I'm just going to look at your reflex first, and then I'm going to go into your eyes. So just go ahead and look. I'm just going to make sure I see that red reflex. Good. All right, now I'm just going to come in to look at your eye here. Looking at all the blood vessels. I'm looking at the macula. Very good. Okay. I'm going to come to the other eye and do the same thing. Go ahead and look. I'm just going to look for that red reflex first. Good. Now I'm just going to come in here and look. Good. Everything looks good. All right. Do you have any questions, concerns right now? I believe that concludes our head, neck, nose, and mouth exam. Nope. Okay. Thank you.
Thank you.